Zang Physical Therapy here, and today I want to talk a little bit about knee arthritis and specifically that surgery doesn't have to be the solution or answer. And this is something that runs counter to a lot of individuals' mindset and the medical community in general, which of course wants to push uh, people into surgeries and having injections before surgery. Sometimes they do recommend people actually do therapy beforehand. Oftentimes, this attempt comes way too late in the game, and it's kind of a last-ditch effort. And the orthopedic surgeon's like, go try therapy. It may help. We're just going to check a box. That's not a way to check a box. That's not a way to go through therapy and potentially get benefits. When it's phrased like that, people expect it not to work, so they're less likely to put in true effort. And also there's something called expectation bias. So if the expectation is set that it's not going to help, it's not, because you don't believe it's going to help. When in fact, arthritis in any region of the body is a very slow, progressive condition, and oftentimes arthritis, might start in individuals in their 40s or 50s, and they may or may not even have problems at that point. Sometimes people don't even realize it until a doctor takes some picture of a joint or something, because something hurts or there's an injury. Even worse, they sometimes take pictures of an area that people don't have an injury or issue, and then they come back to the person and tell them everything that's wrong with them, even though this person didn't have a problem in that area. So, back to the point at hand, arthritis again, slow moving condition. In a picture of your knee does not tell anyone how to treat you outside of if you are looking for a needle or a knife. Okay? So if you're not interested in an injection or a needle, or you're not interested in surgery or knife, there's no reason to go have a picture done of your knee. Whether you think you have an arthritic condition in your knee that's going on, just because you have some aches or pains or not. You don't want a needle or a knife, don't go get any image, because that's where you're headed. That's where the data says. Pictures equal injections and surgery. If you want the other solution, you can have that. That may involve working on some flexibility or mobility of your knee joint. Very helpful for people with arthritis. Strengthening up those legs, the hip muscles, the quads, the hamstrings, the glutes. These help people who have knee arthritis function really quite well. Could be working on things like your balance. How long can you stand on one foot? An average adult should be able to maintain at least 30 seconds. If you're an adult who has some amount of knee pain, who you believe is arthritis related, and you can't stand 30 seconds without touching onto, say, your kitchen counter, that is an area that needs to be addressed. And so often I hear people say, well, I never had balance. Well, that's a lie. When you were a kid, I bet you did have balance, because I watch it in my daughter and her friends, and they're constantly seeing how long they can balance on one leg. Can they hop on one leg? Can they turn and hop on one leg? Can they walk on a balance beam? Can they walk on a narrow crack in the sidewalk without losing their balance? Kids learn this from a young age. It's just as adults, we get away from it, so we're not as good at it anymore. But it doesn't mean that we can't be good at it again if we practice and if we work at it. Okay? So, again, if you're somebody who's in their 40s or above, and you have these nagging knee aches or pains, and it's difficult to get out of a chair or squat down or to kneel, and you're worried about what is going to happen down the road. And maybe some doctor said, eventually you're going to need that knee replacement, just go live your life, and you feel you want to do more because you want to be active, and you don't want that surgery, then here's what you can do. Again, work on your flexibility, your strength, your balance. All these types of things can be taught to you by someone like myself, who's a physical therapist. You know, maybe you're working with a trainer, and that may be okay. They may be able to help get you and guide you through. If you're looking for a little bit more specifics in developing a program that's going to address all that you need specifically, and it will be meaningful and very specific for you and not just a general program, then that's where somebody like myself comes in. As a physical therapist, we can dial that program in for you. It doesn't mean that you're going to have to be involved in therapy for weeks and months on end. If you like it and enjoy it and want to, absolutely, we'll see you and help guide you as much as you can. But a lot of what we have for people with knee arthritis is teaching them how to get stronger, get more flexible, improve their balance, and to do it on their own at home. So, if you're looking for a program that you can do at home, you know, let's have discussion, and let's find out what is going to be helpful for you in the long run, so that surgery doesn't become the answer for your knee pain. Rather, doing simple exercises is the solution for you. Okay? If you have any questions, put them in the chat bar below. Send me an email. Certainly happy to have a longer discussion as necessary to answer your questions and to get you moving in a healthy, positive way. Have a nice day.